Hi, my name's Adrian Dix. I'm the Minister of Health for British Columbia. It's beside me is Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. We're honored to be here on the traditional territory of the Musqueam, the Squamish of the Tsleil-Waututh people. This week we'll be briefing every day at 3:30. Tomorrow that will be in the Press Gallery Theatre in Victoria, as it will be Thursday. On Friday it will be right here at the Cabinet offices in Vancouver. And with that, I wanted to introduce Dr. Henry.
To start off with our update today, we have 7 new cases in British Columbia to tell you about, which brings our total to 39. To start off with, we have 2 new cases associated with the Lynn Valley Care Centre. Both of these cases are healthcare workers who were working in the area of the outbreak in Lynn Valley. They're both in isolation at home. There's been a number of testing being done on people with symptoms, and there are no new cases in residents of the Lynn Valley Care Centre, so that's good news. The initial person who was identified in the community as a care worker at the Lynn Valley Care Centre has been admitted to hospital overnight. She's in stable condition and is being monitored and cared for. I just want to talk about the ongoing investigation at Lynn Valley. I mean, obviously that's very much a concern for us, and everybody in the facility is being monitored and assessed, and those who have symptoms are being tested for COVID-19. And I just want to reiterate that because I think there was some confusion with some people in how I said this before, but there is no value to doing testing for people who don't have symptoms after an exposure. So they are monitored for their health, and if any symptoms arise, then they're tested. So the investigation continues on trying to determine exactly how this virus got into the population at Lynn Valley, both the healthcare workers, the residents and families there. And that is something that will take some days for us to get down to the bottom of. 3 of the cases that we've detected today are travel related. One of them is a woman in her 60s who was on a tour in Egypt, and we think this is interesting. Another close contact of hers who was also on this tour is being tested and may well test positive as their symptoms just developed, so that's would not be surprising. We have heard from colleagues across the country, and particularly in Ontario to start with, that there's a number of cases in Ontario and Quebec that have been related to tours in Egypt, and so we are working with our federal counterparts to see if these tours are related. We know that there has been cases in Egypt on some tours with foreigners who are there as tourists, including some on Nile cruises. And my understanding is that part of the tour that these 2 people were on included a cruise on the Nile. So that's something that we'll be following up on in the coming days. Another travel-related case is a man in his 40s who returned from travel to Germany, and so the investigation on exactly where he was and what happened there is ongoing. He is in isolation at home. And finally, we have another travel related to the Grand Princess cruise, the one that was prior to the one that was just repatriated today, the one from the 11th to the 21st of February. And this is a man in his 90s who was on that cruise, who has tested positive and is in isolation at home. We have 2 additional cases, all of the previous 5 that I've just mentioned are in the Vancouver Coastal Health Region. We have 2 additional cases in the Fraser Health Region that have just come to light today, recently diagnosed, and we're actively investigating those ones. One is a man in his 90s. We're not clear yet where his contact might have been, so that investigation is ongoing, and he is currently in hospital in Fraser Health in isolation. The other is a man in his 40s, again a community case that we do not yet know the link, and he is in isolation at home. It is, as I mentioned before, it is these community cases that give us some degree of concern and grief, but knowing what, being able to detect them is really important, because as soon as we can detect them, we can start that detailed investigation to find out where they might have come in contact, and it helps us uncover where other chains of transmission are in our community. And as you will recall, the case we're calling case 21 of the healthcare worker who worked at the Lynn Valley Care Center, it was by understanding where she was and going through that detailed detective process that we were able to uncover the outbreak at Lynn Valley early enough that it appears still a small number of residents are affected. So we know that this is another area that we need to focus our attention, and there's a lot of work going on right now, even as we speak, in the Fraser Health region with my colleagues in public health to do those detailed investigations around these two new cases, and we're actively hunting for the potential source for these cases so that we can. The nice part of that we do is now these people are in isolation. We know they're close contacts. We can stop those chains of transmission so they don't continue in our communities. On a positive note, we've also had some people released from hospital, including, really pleased to say, the 80-year-old woman who's admitted to ICU at VGH is now released from hospital and is recovering at home. And one of the passengers of the Grand Princess, there were two that we mentioned, both in their 60s, and the male in his 60s has been released from hospital as well. And his travel companion remains in hospital, but is also in stable condition and doing well. The other sort of major thing that's happened, I guess, globally that affects us these days, we've had our first, yesterday we reported our first imported case from Italy. And as you are no doubt aware, the situation in Italy has scaled up dramatically in the last few days. And we know that there's cancellation of flights and restriction of movements from the entire country now. And in addition, we'll be asking anybody who comes, who's a returning traveler to Canada and to BC from Italy, to self-isolate for 14 days after their return. So that's the same provisions that we have in place for people coming here from Iran and from people from Hubei province originally, although the risk in Hubei province, as we know, has decreased dramatically. As well, our pandemic preparedness continues, and the minister will be talking a bit more about that. We're wrapping up testing and testing ability in our community. We've done almost as many tests in the last 4 days as we did in the first 2 weeks of monitoring for this, or in the last 2 weeks of monitoring for this, for COVID-19, and that includes our community surveillance. And it's sometimes a challenge to know if we're doing enough, and the fact that we are picking up some community cases is both concerning and reassuring. Because we are doing so much testing, we know that we are going to pick up sporadic cases, but it also gives us a sense that there's not a lot of them out there that we're missing. But we do need to ramp up our testing capability, both in the laboratories, and we talked yesterday about the expansion to other laboratories being able to do the tests around the province to decrease the turnaround time for testing. But we're also, each of the health authorities is looking at the best way to facilitate testing for people who need it in each community, and so that will look different in different communities, but there's a lot of innovative things that we're looking at. We have done some drive-by testing, as you've seen from places like Korea, for example, that have been done in some of the communities in assessing people who are close contacts. Public health has gone into homes for people who are close contacts and done testing that way. And the idea that we want to do is making sure that we can test people who don't need medical care outside the home. So people who have mild enough symptoms that they can be tested in the community and that they need the test can be done without having to go to the emergency department. We want to make sure that we maintain our capacity in the emergency department in the hospital sector for those who actually need that type of medical care. We also are, I did want to talk about the fact that we funded 2 important research studies which will help us understand about transmission of this virus in our community. One of them is a serologic study that, although we don't actually have a test yet, we need to start now in understanding what the baseline is, and then once testing becomes available, we can have an assessment of how broadly this virus has been transmitted in our community over time. So it's something that will help us in the future to understand how this virus is being transmitted. The second one is a study that it helps us understand potential impacts. So it's a modeling study, all of which we often say that all models are wrong and some of them are useful. And this will be a study to help us understand transmission in the community, what type of interventions might be more helpful in different areas when the need arises. So that study is being done. Both of these are being led by some of the scientists at the BC Centre for Disease Control. Finally, a lot of questions I've been getting lately are about mass gatherings, small scale, large scale, international, and other mass gatherings. And I want to assure you that we have a process in place for doing an assessment, and a risk assessment we call it. And those documents, if you're interested, are available on the BC CDC and the Public Health Agency of Canada website. And it's a guidance that helps us look at, who's coming, is it indoors, is it outdoors, what are the things that increase the risk, but also what are the things that organizers of mass gatherings can do to help reduce the risk for the participants. And that can be anything from an encouraging and supporting people not to come if they're sick, things like refunds or deferring payments, encouraging people and giving them the ability to clean their hands regularly, to allow space. If things are outdoors, for example, it's much easier, much less risk than indoors. Supporting increased frequency of cleaning in different areas, things like not having communal meals or buffets, but having individual packaged meals. There's a whole host of things that we can do to reduce risks and still allow these important gatherings to happen. So those are things that we're working in the health authorities with organizers around the province, recognizing that the transmission that we have right now is still very low. And most of our risk is really around travel and international travel, including travel to Washington State at this point. So my message to you today is, we are still in a state of very high vigilance. We're watching very carefully what's happening around the world. We know there are things that we can do in our community today that will help all of us protect ourselves, our families, from the transmission of infections. And you've heard me say it over and over again, but cleaning our hands regularly, covering our mouth when we cough, not touching our face and eyes, and most importantly, of course, is staying away from others when we're sick. Even if we do not have this virus, and we don't need to be tested necessarily for this virus, for COVID-19, right now we all need to do our part to stay away from others, to be able to work or do our schooling at home if we're not feeling well, and to protect ourselves and our communities, and to protect those who are most vulnerable in our communities. And we know that that's our elders and our seniors.
Thank you. Just a few words in addition to what Dr. Henry has said today. First of all, as Dr. Henry says, we're at 39 cases. Just to put them in context, 16 of them are linked to travel to Iran, 1 to Hong Kong or India. That's our case that happily, woman in her 80s who was happily discharged today, 1 from Washington State. 8 are linked to the Lynn Valley Care Center. Not all those are in or involved in the Lynn Valley Care Center. There are 2 who are family members or close contacts of one of the healthcare workers. 3 from the Grand Princess cruise, which came back February 21st, 1 from Italy, 1 from Germany, and 2 to be determined. 24 are in Vancouver Coastal Health, 14 are in Fraser Health. as Dr. Henry has said, we have dramatically increased the level of testing this week. As you'll see when we release this data on Friday, we've done significantly more testing this week than in the previous 2 weeks, which themselves represented dramatic increases in testing. And we're now doing the tests and completing the tests at 5 sites around the province, although it is all under the auspices of the BC Centre for Disease Control. I want to say a few things about some issues that have emerged in the last few days. First, with respect to the Lynn Valley Care Centre, because it's clear, and we know this, that there were staffing issues, especially on Saturday and Sunday and into Monday at the Lynn Valley Care Centre. Today, there were full complements of staff, both at the morning and the afternoon shift, which just began, I believe, at 3 o'clock. And those issues have been dealt with to the credit of the Lynn Valley Care Centre and Vancouver Coastal Health, which has been working hard to improve the situation there. In addition, Vancouver Coastal Health assigned communications staff to help communicate with families, to contact each family member in this period, in this 24-hour period, to get full and comprehensive email lists so that updates can happen more regularly, and also concerns can be communicated and we can connect with family members more regularly. A full-time infection control specialist from Vancouver Coastal Health is on site. And so significant actions have been taken today with respect to those concerns. And in terms of the staffing level, the care center is at full complement, and that is to the credit of the care center. If I may say, and I am consistently and continue to be consistently impressed with the quality of news coverage we've received, that I just ask, especially people in the news media, to consider to the maximum extent possible, not bothering people who are their family members going in and out of the care center, or care workers going in and out of the care center. One of the reasons, and there's no reason in community cases to say who or where people are, that we've done that, is both to maintain their privacy and help people get better and help people do the difficult jobs they're doing. And this is not a general criticism or anything else. I would just appeal to members of the media and others to treat the people involved with respect. We have seen significant increase in 811 calls, and there was questions about this yesterday. In a general sense, 811, which is a very popular service, receives about 1,200 calls a week through 811. There are nurses, there's a complement of nurses working on the nurse line component of that. That has peaked this week to 3,800 calls, which is a dramatic increase, for more than 3 times the number of calls. And so we are responding by increasing our complement of people. During high call volumes, we average 25 nurses versus 10 to 15 on typical days, but we are increasing our capacity there and opening a new call center so that those calls that come into 811, for example, from members of the public who want advice on risk assessments, those would be diverted, all those that aren't involved with personal health issues, to another phone bank, and that will be in place later this week. Just for those of you who wanted to follow up on the announcement on Friday, the Provincial Emergency Management Coordination Center is underway in British Columbia. The Deputy Ministers Committee that we spoke of, that the Premier appointed last Friday, is meeting now. A lot of work went in to prepare, and so they're reviewing the work that's been done. And over the course of the week, we're going to dramatically increase our communications, not just within healthcare, but within government as well, and our organization in preparation for in implementing at this stage of our plan. And finally, as Dr. Henry suggested, we're also working, and you'll see this in the coming days, in communities to address the assessment of people who have been referred for testing, to provide the safest possible types of care, and that will be different in different communities, but you will see that in communities around British Columbia. And if I may say, just finally, what we're seeing here is first of all some positive news, but of course some really challenging news for the families involved. We have 39 cases. We've done enormous amount of testing in BC. We continue to do the most testing of any jurisdiction in the country, and I think that's significant. And the reason we're doing it is because of a strong effort to to continue to contain the virus in British Columbia and to slow down the virus in British Columbia. And that's why every case is treated with such seriousness by Dr. Henry and by the entire healthcare team and the health authorities. Je voudrais dire en français qu'on a sept cas nouveaux en Colombie-Britannique, deux liés au Lynn Valley Care Center, qui sont des travailleurs de soins au sein du centre là-bas. Donc, il s'agit maintenant de 8 du Lynn Valley Care Center, 2 qui sont des résidents, un qui était mort hier, malheureusement. Il y a 2 qui sont liés à un travailleur de soins là-bas, qui sont chez elle, bien sûr. Et il y a en total 4 travailleurs de soins qui sont là aussi. Il y a 3 nouveaux cas liés au voyage, un d'Égypte qui participait en pince à une croisière sur le Nil en Égypte. Donc ça c'est un nouveau cas. Un cas d'Allemagne qui est un nouveau cas d'Allemagne ici. Et on fait une enquête, bien entendu, à la fois locale et internationale sur cette question. Quelqu'un de 90 ans, un homme de 90 ans qui était sur le Grand Princess, notre 3e cas du Grand Princess dans le voyage qui a terminé le 21 février. Il y a 2 cas où l'origine est inconnue. Un homme de 90 ans et qui vit le visa Fraser Health Authority, et un autre homme de 40 ans qui vit aussi le Fraser Health Authority. L'homme de 90 ans est à l'hôpital. Et finalement, la femme de 80 ans, l'octogénaire qui était à Vancouver General Hospital, n'est plus là, elle est chez elle, ce qui est quand même extraordinaire. Et nous voulons féliciter le travail des gens à Vancouver General Hospital et elle aussi pour ce qui est arrivé là-bas. Donc, avec cela, we're ready to take questions.
Thank you, Minister Dix. We will now take questions. We'll first take questions from the room here and then go over to our phones. A reminder to our media colleagues on the phone to please press *1 to line up for questions. And also a request to please keep your questions limited to 1 question and 1 follow-up, please. We'll begin with CBC here. Dan?
Dan Burns, CBC. Dr. Henry, spring break coming up. What's your advice for families planning to either travel or if they're going to stay in BC?
Right. Yes, we're very aware of that, and we have been talking with the schools and with the system. And right now, everybody has to do their own individual risk assessment. However, we know that international travel is very risky, and you can get caught up in, it may not be just the risk of contracting COVID-19. It may be being caught up in measures that are put in place quite suddenly, and we saw that, as you know, in Italy. So my advice to people is to be very aware of where you're going. There are travel advisories that Canada has put out, including one that that advises against travel on cruises and travel to certain countries in the world. I would adhere to those. I think travel within Canada is still very safe, and certainly here in BC, it's very safe.
And on the testing front, we're hearing from people who have been concerned that they actually can't get tested. Where can people, just to clarify, get tested right now, if not at a doctor's office or at a clinic or elsewhere?
Yeah, so that is, you know, I think the challenge is that we've been talking a lot about testing, and anybody who has symptoms feels that they need to be tested for this, and that may not be the case. So we advise people, if you have symptoms, to self-isolate, stay at home. If you have symptoms that need medical assessment, call ahead. And if you do have concerns about COVID-19, call 811 or call your healthcare provider ahead of time, and they'll be able to direct you to where you can safely be tested.
Thank you. Frank, Omni Regional.
Frank with Omni News. First, a little clarification, because Minister Dix just said the 24 in Vancouver Coastal Health Region, 14 in Fraser Health Region, but the total number is 39. So why is that?
So there's 1 in Interior Health.
Oh, yeah, why Interior? The second is a real question for Dr. Henry. We have had 3 community infections now, and why we are still not going to release where they have been before they become symptomatic, and whether they have been symptomatic before they seek help.
Right. So with every case, we do an investigation. And for the ones where we aren't clear where the source comes from, we do an investigation back several weeks to try and find out who they may have been in contact with. But as soon as somebody starts, so we not only start at the day they start having symptoms, but we do a detailed day by day, exactly where did you go, who were you with, how did you get there. So we have all that information. And then we contact people who are, anybody who has close contact and who's at risk. If we do not have the ability to contact people, for example, if somebody was in a public place and they didn't know all the people there, we would make that public. But we have not been in that situation where we think people have been at risk, where we've not been able to contact them in some way or the other. So there are different risk categories. We know that this is a droplet transmitted virus, and that you are most likely to transmit it to the people that you live with, that you spend time with, that you're in close indoor settings with. So those are the people that we focus on, and those people we contact them directly, and we put them in quarantine, if you will. So we ask them to self-isolate at home. We monitor them daily. We call them daily. Sometimes we go out to their house if they have symptoms. We may take samples if they start getting sick. Sometimes they have this, and sometimes they have something else. So people have developed symptoms and tested negative. We've done some detailed investigations on flights, for example, where we know that it's not a great risk on an airline, but it is a small risk, and we are able to get flight manifests and connect with people who are within the risk area. So we know that actually the ventilation systems on airplanes, the way they're designed now, you actually aren't exposed to a whole lot of people around you. But we do know there's a slightly increased risk in the people that are immediately around you. So we are able to contact them. Most recently, I will say, there have been a few cases just in the last couple of days where it's been challenging to get the flight manifests. And so we, in that case, we may put out a public alert saying if you are on this flight, to monitor for symptoms, because these are not considered high risk. And if you have symptoms, to self-isolate, obviously, and to call 811, and 811 will have the details of exactly where somebody was, so they can tell you if you're in a risk or not. So that's how we manage it. We have gone public with issues. We've also given letters to certain groups where people have been in a group setting for a period of time where we think the risk is slightly higher, and ask them to take certain measures and to monitor for symptoms as well.
And cruise season is quickly coming, and the first ship is going to be docked here is Grand Princess. So decision need to be made quickly whether to delay the cruise season. So what is happening now with that issue?
Yes, there are ongoing discussions at the federal level. As we know, the jurisdiction is Transport Canada, CBSA, and they are in ongoing conversations with the cruise industry. We've been involved in providing advice, and I said my advice yesterday. I think we need to be most cognizant of the health of the people here in British Columbia and protecting our health system. And I feel with the international risk that we have right now around the world that the cruise ship season should be delayed in this province and the East Coast as well. But I expect that we will hear something about that in the coming days.
And just to say, to understand what we learned today, we now have the Grand Princess for a trip that ended February 21st, 3 cases in British Columbia alone, other cases elsewhere, which shows the situation. And then we have the same boat now in a federally organized evacuation of Canadians. So the warning that was given by Dr. Tam, the federal medical health officer, Minister Haidu, the federal minister, around people taking cruises now. We're not talking about the British Columbia cruise season or the Canadian cruise season, is an important warning for them to receive. Because remember, that warning now exists and has been given. And I think it's important for anyone considering taking a cruise to understand that once that warning is given, that has implications for what the Government of Canada might do in case of a situation similar to the Grand Princess. So this is a situation we're facing. 3 cases from there, 1 potentially linked to a cruise on the Nile. So these are significant issues. So when we talk about these issues, they're really substantive questions.
Dominique Arnoldi, Radio-Canada. Any plans to open specialized clinics specialized for the testing of the coronavirus only, like they've done in Quebec? They just started 3.
Yeah, so each health are and how they can best meet those needs. And certainly in some communities, there's ample clinics and clinicians who are willing to do the testing. In other communities, they're looking at more innovative ways to make it easier for people so that they can come in on a set time and not have to be in a physician's waiting room, etc. So those discussions are ongoing at a provincial level, yeah.
Oui. Et en français, juste dire que chaque région de santé travaille là-dessus. Maintenant, il y aura des centres pour faciliter les tests bientôt, surtout dans les communautés où il y a des questions pour parmi la population des médecins ou des questions sur les gens qui attendent dans nos bureaux de médecins. Donc, on travaille là-dessus et ça fait partie de l'augmentation du système des tests en Colombie-Britannique qui va continuer.
Dernière question en français aussi pour M. Dix. Étant donné la crise qui se passe à Seattle en ce moment, est-ce que vous êtes inquiet de ce qui pourrait arriver aux Britanno-Colombiens? Et si oui, qu'est-ce qu'on fait pour se protéger?
On est inquiet premièrement pour nos amis américains, n'est-ce pas, qui vivent cela maintenant. Il y a beaucoup de cas et il y a beaucoup de monde qui sont morts là-bas. Nous avons perdu quelqu'un ici et nous savons de très près la douleur de cela. Et je pense que les gens dans le système de santé à Washington travaillent très, très, très fort. On avait une avance importante en Colombie-Britannique parce qu'on a commencé un programme de tests compréhensif dès janvier qui nous a aidé beaucoup. Mais bien entendu, des liens dans le monde sont étroits, n'est-ce pas? Surtout entre la Colombie-Britannique et le Washington, mais aussi entre la Colombie-Britannique et Téhéran, entre la Colombie-Britannique et la Chine, etc. Donc, nous sommes tous liés. Le système de santé primaire à Téhéran a une influence sur nous et surtout la situation à Washington. Donc, on va continuer à travailler ensemble avec les dirigeants à Washington pour protéger les gens dans nos 2 juridictions. Mais c'est bien entendu une préoccupation, mais nous avons un cas, un seulement, qui vient de Washington jusqu'à maintenant. Mais on va travailler bien sûr sur cette question et ensemble avec nos amis à Washington.
Korea Daily.
Yes, my name is Young. I for the Korea Daily, and I have a question still about that. As you know, that Korea was the second, the highest number of the coronavirus country today is anyway 4th, but there is no any confirmed cases related to Korea still out in BC and in Canada. What percent of have you done this individual or the samples related to Korean in Canada and in BC?
Yeah, I don't know that we know that, and we don't ask those questions necessarily. And I only know the details of people who are positive. But I think it's a testament to the work that's being done in Korea right now to understand who is being infected, to understand the outbreak chains, and to prevent or discourage anybody who's ill from traveling, that we have not seen any imported cases. And I think there's very few exported cases from Korea anywhere in the world.
One of the sources the evoke in Korea is the religious groups that hide their symptoms and the religious gatherings. So it's caused the current situation. So in the case if anyone who voluntarily reported their symptoms, in the case how to find out them?
So that it would be the same as anybody else here. They would report it to their family physician or call 811. And certainly Korea has been on our watch list for people as a risk area, but nobody has tested positive from there yet.
Thank you. Next question, Fairchild.
Hi, this is Jason from Fairchild TV. and we're seeing the number of cases is increasing, and we're just wondering like how many isolation rooms in the hospital we have in BC, and if the number of cases keep increasing, and if we have
that we obviously are monitoring. There's a couple of different ways that we can look at this. So this is a droplet spread infection. So the minimum that we want is a single room for somebody. But if we start to have a lot of people who are ill with this, we can do what we call cohorting. So we have rooms that people with the same disease can be in. So there's lots of plans for looking at that, for scaling up. And when we do certain procedures for people with this disease and certain others, what we call aerosol generating medical procedures, so things like bronchoscopies and things, then we want to be able to do that in what we call an airborne infection isolation room. And we do have those in all of our facilities, all of the hospitals that are able to look after people. And it's a matter of prioritizing and rearranging how we do those work.
Yeah. And we have 3 cases right now in acute care, 3, because as you know, two people fortunately left hospital today, so that's a very positive thing. So it's something though that we're preparing for in every health authority. It's why every health authority now has an emergency operations center whose responsibility is to assign and allocate staff as need be. A lot of that staff is needed right now in the community because that's where the cases are and that's where the work is happening. But one of the principal concerns, and you saw this in what we presented last week as part of the plan that we put forward, is concern for vulnerable people. For the most part, our cases have come from travel around the world, meaning from people who have both the means and the ability to travel internationally. So that's been the group of people so far, and we are preparing to take action and to protect vulnerable people in the community should the virus extend out into the community. And you see this, of course, most especially right now in care homes, but there are other people, as we all know, who are vulnerable in the community as well.
Thank you. Next question, Singtao.
James from Singtao Daily. So there's 8 cases related with the Nile Valley care home. So do we consider this as a kind of community outbreak?
This is a facility outbreak, yes, and with 2 of the cases being family related to one of the workers in the facility, yes.
So do we prepare something for a massive community outbreak?
Yeah, so what we have been preparing and what we're looking at is the stages that we see from the WHO. So they have the 5 C's, they're calling it. So they have countries that are clear, and there's fewer and fewer of those every day. There's over 100 countries that have reported cases. There's countries that have sporadic cases, and if we look at BC, we certainly have that, mostly imported travel-related cases. Then we have clusters of cases, and we have dealt with a few small clusters of cases. And then we have outbreaks and community outbreaks. So this is a small facility outbreak, not unlike what we see with other respiratory viruses causing outbreaks. And our goal and our focus is on preventing wider community outbreaks. So we are not at the point yet where we have wider community outbreaks. And that is what we're actively every day spending our time trying to investigate, hunting for potential sources so we can break any chains of transmission and prevent any larger community outbreaks. And then, of course, there are countries that have countrywide outbreaks. And right now, we know China's in that position, Iran is in that position, Italy's in that position. And we are going to do everything we can not to be there.
Thank you. One more question from CBC before we go to the phones.
Hi, Georgie from CBC. Just going back to Washington State, is this the first time that you've sort of, mentioned Washington State as being a high-risk travel place now? I know that today they announced another 74 cases, 2 more deaths, and 10 nursing homes just in the King County area are now involved. So what is the risk there, and how seriously should should Canadians be taking that travel warning?
I think we should always be taking it seriously, and from the very beginning we've said that. I've not changed my my assessment of our risk in Washington State. I know that my colleagues were playing catch up, and they're working very hard, as we are, to find all of those pieces and where people have been infected, where people are transmitting this, and to try and stop those transmissions. Again, to travel to Washington State, other parts of the United States where they're having unrecognized transmission in the community and clusters and outbreaks and community outbreaks that we're seeing, like Washington State, we need to be aware of that. We need to take precautions, certainly not travel if we're ill ourselves, and if we are somebody who is at high risk of having severe illness or dying from COVID-19, to reconsider travel to any of the areas where we know this might be a risk. Otherwise, taking our usual precautions, but being a little extra careful, staying extra distance away. We've been, in the US, they talk about arm's length, staying arm's length from people. That is something that protects you. Not going to mass gatherings or large events, cleaning our hands regularly, trying to do those other measures that prevent you from becoming infected.
Thank you. Will.
And just a follow-up question as well. Now that the community cases were up to 3, they're becoming, I suppose, less exceptional now that we have 3. How do you sort of tell people out in the public to sort of not become too anxious, but to take the risk seriously?
Yeah, you know, this tells me that our surveillance is working, that we're finding people, and when we know about them, we can do something about them. And I think that's the challenge that, for example, in the US, when they weren't actually looking for cases that weren't related to travel, they weren't finding them. And when you look, you'll find. And so it is reassuring in a sense that we're finding these people, but it also tells us that there's something out there that we're missing and we need to investigate. So right now is the time where we are putting lots of effort into finding out exactly how people became infected, making sure that we can link back to things like the nursing home outbreak to prevent it from being spreading to other care facilities in particular. But we all need to be aware that there are people who are coming into BC, there are people who may have this, and we need to take those precautions on a community level to do our best to prevent transmission of all infections. And so the awareness really is that we all need to take those measures right now.
Thank you. We'll go over to the phones now. The first question on the phone is from Shannon Patterson, CTV. Please go ahead.
Hi, Minister, and hi, Bonnie. Can you talk about, tomorrow we're expecting an announcement from the federal government about compensating. Can you guys hear me?
Yes.
Okay, sorry. We're expecting an announcement 9 a.m. tomorrow from the federal government about compensating people who are told to self-quarantine or who have symptoms at home. Talk about how important that is, that people feel confident that if they're feeling sick, they're not going to miss a paycheck, because there's a lot of concern that some people just can't afford to do that, so they're hesitant to miss work. They're even hesitant to see a doctor for fear of being quarantined. How important is it that people feel confident and that this federal government money comes through to make sure people are compensated while they're home?
I'll start, and obviously that's really important. One of the things that we've been talking about is how important it is to tell people what you need them to do, but then give them the means to do that. And this has been a concern. We've been supporting people provincially, but I'm looking forward to the federal government coming in with measures that will support people to do what we need them to do as well.
Absolutely, and we'll obviously look forward to the federal announcement. I think, though, the one thing we want to emphasize here is when you're sick, stay home. And yes, we're going to be looking and working on these issues, but if you're sick, stay home from work, stay home from school, don't travel, and absolutely don't go to the place of residence of an older person or to a care home or a hospital. I think it's important to continue to emphasize that. I think the federal government in previous outbreaks, for example, SARS in Toronto in 2003 has taken similar action, and we'll look forward to what they announce tomorrow. These are challenging questions. What our experience has been so far is that the response of employers in cases has been very positive in when people are affected so far. We've seen that response be positive on an individual basis, and we're going to continue to work on these issues as well with the federal government. So it'll be good to hear federal action, and but I think the main thing to remember is, and I know it's difficult, it is difficult sometimes to self-isolate for people for all kinds of reasons, but this is what we do as being part of a community, and we really need to do it now.
Thank you. Next question, David J. Reuters.
Yeah, good afternoon. Thanks for doing this. First question, do your contact tracers have access to serological tests yet? And if not, when do you anticipate that'll be possible?
Yeah, there's not a serological test available for this virus yet. So one of the research projects that we've funded through the Michael Smith Foundation is to collect baseline blood work through the community labs right now, and then we can look in 6 months and a year and see exactly how many people have been infected. But we do not have that ability at the moment. The tests that we have test for the virus in the body, in the secretion, so in the nasal passages. So it's an NP swab or a throat swab, and we do what's called a reverse transcriptase polymerase chain reaction, or RT-PCR test, and that tells us if the RNA from this virus is present in the body and whether you're shedding it. So we don't yet have the ability to test whether somebody's immune system has developed a response, and that's what a serological test does. I know there's a lot of work being done around the world to try and find that, because that helps us understand, for example, in areas of China, it would help us understand what the denominator is of how many people actually got infected with this without knowing it maybe, and how many people ended up in hospital, how many people got sick.
Thank you. Next
And
question.
secondly, is there even a rough timeline for the availability of this test?
I wouldn't have one off the top of my head, but I know I expect it will be within the next month or so from what I've been reading, but I could be wrong. When you develop these tests, sometimes they work and sometimes they don't, and you need to test them in models. It takes a time for the body. It often takes up to 2 weeks for your body to develop antibodies that these tests can test for. So there's a period of time as well where we don't know whether they'll actually work in people. So all of that is ongoing.
Thank you. Next question, Richard Zussman, Global.
Dr. Henry, I'm wondering around the case where there are people who don't seem sick and they can pass that on. We saw many of those cases in Italy. How do we fight against that sort of spread?
Yeah, so I've been watching that as well very carefully, and really it often, the vast majority of the spread, the pressure of spread of this virus is people who have symptoms, but we know that they can be very mild early on, and so that's why we've been saying things like, even if you just feel like you have the sniffles, you feel that sort of achiness, like I'm starting to fight something off. There's a lot of work that's been done to try and look at transmissions, and while we have very limited evidence, of the 80,000 cases in China, there's a few case reports that might have been transmission from somebody before they recognize symptoms. But we do know that you can transmit quite early on in this infection. So when we compare it to SARS, for example, in 2003, the virus would build up in your body over time once symptoms started, and the peak shedding of the virus was a little bit later on, maybe day 3, day 4. With this one, your peak shedding is early on. It may be day 1, day 2, day 3. So once symptoms start, you can shed, some people more than others, quite a lot of the virus. So that is something we're watching, but really to be able to contain this, we really want to contain those people who are much more likely to transmit it to others. The other way we can look at this is, even when we've had cases in households where there's been numbers of people in the same, sometimes a very small house, not everybody gets infected. So it is the things that you can do that interrupt transmission, but not everybody sheds a whole lot of virus. And so there's still reason to believe that we can prevent transmissions and stop transmission chains.
Next question,
And
Shannon.
I know you do the updates on Friday.
Follow-up, Richard? Next question, Shannon Waters, BC Today. Go ahead.
Hi, Dr. Henry. I'm curious about how people are being tested. You mentioned that some of the tests for close contacts are being done at home in a bid to keep people out of emergency rooms. But how many tests are also being done in the emergency rooms themselves? Like if someone shows up there, I know that's not where they're being directed, but if they show up there, is the testing still conducted in that emergency room?
Oh, absolutely. And in a number of emergency rooms around the province, and people often will need to be assessed. So anybody who has shortness of breath, who has difficulty breathing, those are the types of things that you need to go and have an assessment in an emergency department. I can't tell you off the top, but it's less than a third. The last time I looked, were done in emergency departments. The vast majority of the testing's been done in the community in various different ways.
Thank you. Next question, Tyler Olson, Abbotsford News.
Hi. Hi. So Fraser Health is a very big health region. Is there a point at which you would choose to disclose the number of cases in specific cities like the coroner's office does with overdose deaths? And what would be the risk of doing so at this point?
We still have a relatively small number of people, and the risk is really the same for everybody in the region. So at this point, we're not considering it, and anything that leads to identification of people discourages others from connecting with us. And we've seen some of that with the Lynn Valley Care Centre, where we did feel it was important that people knew where the outbreak was, and sometimes that leads to people having fears that are not grounded in truth and reality, and it sometimes leads to people being harassed, perhaps on their way to work and things like that. So we need to find that balance of people being aware of where the risk is and knowing that we're doing detailed investigations so we can tell you where the risk is as well. And I will tell you that of the people that we've investigated, they may live in one area, but they often work in another area, or they belong to a group in another area. So it's not like saying, oh, if we don't go to Coquitlam, we'll be okay, or if I don't go to, some other place, it will be okay.
Thank you. We'll come back to the room for a question. Laura Kane, Canadian Press.
Hi, Dr. Henry. Just a quick clarification. I'm sorry, but could you please repeat how many community cases we have now, and kind of broadly, who are they?
Yeah, so we have the first community case was the healthcare worker who works at the Lynn Valley Care Centre, and we've now traced that back to that outbreak there. And then we have 2 people who are identified today. So we do not yet have their connections, and that's being actively investigated.
Thank you. And then I have a question from our sports department. Nova Scotia recommended that women's hockey be cancelled last weekend in Halifax. It was cancelled. We have women's curling coming up in Prince George this week. Maybe Adrian Dix as well, perhaps you could comment on this, but will the province issue any kind of recommendation to those organizers?
Yeah, so we've been working with those organizers, and Northern Health has been working with them as well. So as I mentioned, we have a detailed risk assessment that we do with all of the events that are happening, and it has to do with the numbers of people that are coming, where the teams are coming from, where they've been before they've come here, the ability of the community, how many spectators there are going to be, how many teams, the ability of the community to respond should something happen, and as well the ability of the organizers to put in place measures that protect people at those venues. And so I know Northern Health has been working very closely with the organizers, and they feel that the risk ratio, the risk profile right now it allows it to continue to happen, and I have confidence in the work that they're doing and the measures that they're going to be putting in place to protect people there. But I will say, and I know Minister Dix will say it too, is that we have a very low threshold for people staying away if you're not well. And the organizers are facilitating that as well. So please don't go to Prince George if you're not feeling well yourself.
And just to emphasize that, that particular event, for example, is televised on television, and well, where else would it be televised? But it's televised on television, and so, and I'll be watching it on television, and so people can watch it just like me, and enjoy it if they're sick. So we absolutely, this is true of every single event in the community, whether it's a church service or going to school or going to work. If you're sick, stay home.
Thank you. Going back to the phones now. Next question, Laura Collins, Surrey now.
Henry, speaking of mass gatherings, what about an event like Visaki in Surrey, which sees roughly 500,000 people, along with food made by residents along the parade route? What would you recommend for that? Should it go on, or?
Well, there are at least 3 significant events, Visaki events, coming up in the month of April, and clearly we're going to be engaging in the same way. The appropriate health authorities, Vancouver Coastal Health in the case of Vancouver, Fraser Health in the case of Surrey. I think there's a significant event in Abbotsford as well that they'll be following up with them. It's a little distance away, but the same applies here, that we have a risk assessment model that can be applied to every event, and we're hoping that event organizers in circumstances like that engage with health authorities to make decisions that are in the best interests of all the people that might go and the whole community.
Thank you. We'll be able to take just 2 more questions. The next question, Marcella Bernardo, News 1130. Go ahead, please. Marcella, are you there?
Sorry, Marcella has actually left the queue.
Okay, we'll wrap up with Keith Baldry. Keith, are you there?
Hi there, you hear me?
Yes, we can. Go ahead.
2 questions if I could. One, just to clarify, back to 811, this new call center, is that to receive COVID-19 calls? Basically divert those calls to this new center?
No, it's to divert other calls, Keith. So we get on the average week 1,200 calls. A whole bunch of those are about personal health, so that will continue to be dealt with by the nurses and others who deal with 811 calls. But if people, for example, have a question about a community event that isn't about their personal health, we're setting up another call center to relieve some of the burden on the 811 line. So we're adding resources to the 811 line. We're also creating another call center so we will be able to divert. If, for example, you were an organizer of a minor hockey tournament in a community and you had information, health information requests 811, those would be diverted to the second call center, and then we would get answers for you. So that's the purpose of that, is to relieve the pressure so that people who have questions around personal health information can get it as quickly as possible.
Okay, thanks. And second question, Dr. Henry, you mentioned we're in a small facility outbreak right now. Do you have a number in mind of when you think we are at a wider community outbreak? We've got 3 cases now of a community spread. Is there a sort of a threshold, do you think?
Yeah, that's a very good question, and it's something we're wrestling with. You know, when does it become, you know, what measures will we take and what will it look like? Those are things that we're in active discussions about with my colleagues across the country, actually. And we've looked at examples of what's happening around the world, so I don't yet. I'm getting a better sense as we're going along, and we're looking what's happened in other countries. Right now, the focus, and it continues to be, and I'm confident we're still in that phase, the focus is on detailed investigation and looking for the common sources of everybody that we see, and we'll stay in that phase as long as we can.
Thank you, and we'll be able to accommodate one last question, Minister Dix, and this is from Cindy Harnett, Victoria Times. Go ahead, Cindy.
Hi, thanks for taking my question. Out of an abundance, hello?
Hi.
Out of an abundance of caution, as you know, GNS Independent School has closed early for spring break as someone is being tested. Is that a reasonable response, given that there's no results yet? And if so, would other schools follow suit? And as a follow, do we have an estimate in the next couple of weeks of how many numbers of hospitalizations, deaths, and that we'll see based on what we've seen so far?
So that, you know, the private school, we've seen other schools do that as well when they've felt that it was in their best interest to support their community, to close for a couple of days to do cleaning. it's a decision the school can make. I don't think it was necessarily necessary, but it's fine in my mind that they want to make that decision, and we will obviously be watching what's happening closely over the next few weeks. And school closures, both reactive or proactive, are things that are in our armamentarium, our toolbox, as sometimes being beneficial for stopping transmission of these types of infections. I don't know exactly what to say about numbers of hospitalizations and cases. We'd like to keep it to 39 for the next ever, but we'll be, doing our surveillance and continuing to test, continuing to monitor.
Thank you very much. Thank you all for participating.